Good evening, everyone, members, and to our guests that we have here tonight. Welcome to the meeting. Very pleased to have you here. I'll take apologies for absence, please.
Thank you, Chairman. I've received apologies from Councillor Dan Adams and Councillor Richard Brooks.
Thank you. Item 2, Chairman's announcements, and welcome to, well, I've done that. We've got a really interesting agenda before us tonight, so I think you'll be keen. Sorry, I'm too far away from this. Oh, thank you. Thank you, Lee. Is that all right with those two lights on?
Yes, that's fine. Yeah, absolutely fine.
Okay. So item 3, minutes of the last meeting held on the 7th of June 2022. Are you in agreement and noted those minutes, members? Item 4, declarations of interest. Anybody have any declarations? Paul?
I suppose I should just mention the fact that I've provided through my members' community allocation at Surrey County Council grant funding to various organisations in the past. So I thought I'd just mention that as a...
Thank you. That would be noted. I also have a declaration of interest in that I do know Maureen Hume very well. I've been working with her a lot, not over the last couple of years with the COVID, but at the Alzheimer's Cafe. And we were reminiscing before the meeting started how we managed to get a big grant from the lottery fund, £45,000, wasn't it, way back, through the ITV. So that was really good work. And Maureen does a fantastic work with that cafe and the people that attend there. And I'll be coming back sometime soon to be with you. Thank you.
Are safe, Vivian, because at the moment we're insisting everybody has a negative evidence of a negative COVID test, just because they're all elderly, as are our team.
Microphone, please, Chairman. You turn your mic on.
It went off.
It's on. Fine. It's on now.
Okay, thank you. We're on to item 5, and for Maureen to receive Maureen's presentation from the Alzheimer's Cafe. Thank you, Maureen.
Sorry, thank you very much. I'm still learning how to use IT.
So are we.
It's my daughter who helps me with all this, you know. I'm way behind. Anyway, we're here to look at the Camberley Alzheimer Cafe and who we are. We, at the moment, what we do, it's a teamwork, and we have 17 members in our team at the moment. And over the last 8 years, people have come and gone because of their jobs or to be with their families, but we still keep up a high percentage of the people stay with us. And they enjoy it. And we all have the same background, if you like. All of us have either had a friend or a family member who has had dementia. And that gives us the motivation to continue to do the work that we do. And of course, strangely, it also means that when people tell us they are quite all right, there's nothing the matter with them, that we know that it isn't so, because otherwise they wouldn't be there. Because there's a lot of...
I'm just going to move this a bit closer to you so we can all hear you.
Oh, thank you, Paul. Did you hear any of that at all? While we're working, yeah. That we have personal interest, of course, involved in all this. We're a group of people with experience, yes. We follow the International Education Programme established in Holland in 1997 and brought to England in the year 2000 by Dr. Gemma Jones. Dr. Gemma Jones now has a cafe set up worldwide, and she visits them as well. I can never tell when she's in England or not, but she's actually coming at the opening of our cafe on the 19th of September. And what I admire about her most is the compassion that she comes across with, always, in caring for the families as well as the person who has dementia. So we provide monthly meetings based on the emotional world of dementia. And why I say that is when I'm a nurse, a midwife, a psychotherapist, and when people came to me telling me what was happening in their families, and they were doing this for years, until eventually one day I couldn't stand it anymore and set about doing something. But what I did in the first year was that I held 2 courses, and the first course was 12 weeks for the U3A, and there were 72 people who attended that course. And what I did then was to bring in as many people as I could from all areas of life, because dementia actually affects all areas of life. The second one I held for the nursing homes, people like that, and the people in shops, and they came. But as I went through that work, I realized that giving the facts, it wasn't enough, because the people were left with the emotional turmoil. So what I did then was to go to our GP, who sent me to the psychiatrist, who sent me to the Alzheimer's Society, and Hilary Dice, who runs the Farnborough Alzheimer Cafe. Now, that was the one that was first set up in England in the year 2000. And I attended there for a year, learning how to do the job. And it did open a lot of eyes, 2 eyes for me. So that is why I've said the work is about the emotional side. Of course, where it's any other factor to do with, say, with money or housing or anything, we do signpost the people to the people who can help them. We offer refreshments and cooked meals, tea and coffee. And in fact, the cooked meals actually uses the most of our money, believe it or not, at the moment. It's time for our guests to exchange experience and to make friends. And that, Dr. Gemma Jones considered that this happens in the last half hour of our sessions. And Dr. Gemma Jones believes that that is the part where the healing takes place, because they're expressing what they're feeling with other people who can listen and understand. All this is to enable visiting families to attend any cafe, anywhere, and to relax. And that is why the program is the same worldwide, because they know what they will be meeting. And people with dementia and their families, they do travel, and they do go on holiday, and they do visit. Over time, we've adapted to meet the needs of the people in our locality. We now have monthly, well, the last 2 years, we had monthly Zoom meetings over that 2-year period. We've only just opened up in April this year, again, face-to-face. Over that time also, we had weekly keeping in touch phone calls to those who selected for this, and a small team of 5 of us phoned 50 people every week and listened to them. Now you might think, oh, it's just a phone call, just a phone call. This has had an amazing impact here in Camberley. And I can only tell you that from January year 21 until June, I personally have referred 16 families for safeguarding, because the families were in such utter distress. And amazing, and it's not amazing, it's almost like a miracle, the fact that our adult social care locality team, that they have taken action within 24 hours. Now, I have known that this costs money, whether it's putting carers into the home or putting the person into residential care, all costs money, but our services provided this. And I occasionally talk about this to other people in other parts of the country. None of them know of a service that acts as quickly as this. So it is well done here in Surrey, the adult social care. And at first I used to be frightened of calling them, because I used to think, am I being hysterical? Is the family being hysterical? But I soon learned that they acted so fast that, you know, they took it seriously, whatever I did say. I've told you that, I arranged safeguarding for 16 families in 20 months. In my work in 10 years as a psychotherapist, I ever only referred one person for safeguarding, which tells you of the sincerity of the seriousness of the situation here for families. And I think it was the loneliness, you know. We had a number of deaths in the first year, and I'm sure that, again, nobody dies with COVID. It was, I'm sure it was loneliness, the impact of the loneliness. And one of the heart-wrenching moments was a man who said to me on the phone at the end of our conversation, "Oh, Maureen, it is lovely just to hear another voice." And there's just once in a week, one human voice. So it tells a lot about how the people are feeling. We ran the Man with a Pan courses for 4 years. Now, again, this came from the needs expressed by the men who were left on their own when their wives were too ill to do anything or who had died. And in that 4 years, we've had 100 people through those courses. We also took, we had people referred from the Hope Hub on these courses as well. And what actually has happened is that some of those people have now been able to go into employment because they were learning the skills, and they also went on the safe food handling course too. So these things do have an impact. Now, where do I go next? Yeah, the key things to know about dementia then. Dementia itself is an umbrella term for up to 200 conditions. So it's not one condition. It's caused by diseases that physically affect the brain. So if you think about, we hear mostly about Alzheimer's disease, and that accounts for 66% of the people under this umbrella. Alzheimer's disease is where amyloid plaques get deposited in the cells, and it means where the plaques are, the cell can't work effectively. There are also tangles also, and some of the scientists are now saying that the tangles, this is a protein called tau, that this actually creates more damage than the actual plaques. But it does mean, well, what we know is that not all cells are full of plaques, and not all the cells that are affected, they're not necessarily 100% affected by the plaques. So it's a varied disease. So it's 66% for Alzheimer's, it's 17% for frontal lobe disease. Now that is, I can tell you, but I wouldn't want this to go into the newspapers. This is a sad disease because in fact it's the amygdala, which is a center for emotions, which is so affected. And they lose any feeling for whether it's the wife, the husband, their children, they lose that emotional tie. And that's very, very hard for the families to take. And then there are, as I said, there are over 200 conditions. But some of those conditions are treatable and can be managed. And one story which I admire so much that happened not far from here was a man with a pharmacist who had retired. And eventually they thought that he had dementia, and he was diagnosed, and he kept having urinary tract infections, and the GP was just giving a broad-spectrum antibiotic and kept doing this. He kept getting these conditions. He'd get the antibiotic, he'd get well again for a little while. But his situation became so desperate that eventually he agreed to sell his house, move into residential care. It's individuals that matter in this world. In that nursing home, there was one person, one soul, who decided to take a specimen of urine and send it to the lab to find out exactly what was causing the problem and the correct antibiotic. They gave the man the antibiotic. And what happened then, he became so well that he didn't want to go home. He liked living in the nursing home, but I helped to care for other people in the home because as a pharmacist, he was used to caring. So, it's these little things that matter, And I thought, I'll probably never meet the person who did this, but that person really deserves a prize. And I just remember as a student nurse when I was a young woman, we had to do these specimens every morning. And at that time, I used to be so bored with them, but I understand better now. Anyhow, I shouldn't be going on about this. I've got 10 minutes. Dementia, then, is more than just memory problems. It's not an inevitable part of getting older. I'm a lot older than many of the people that I work with. but it is progressive and ultimately causes death due to health complications. And that can be any of a number of things. It can be an infection, often a chest infection, but it also can be a fall and the impact of a fall. So that's that little bit. So we provide then monthly in-person meetings. We do enable friendship. You can't force friendship. We enable everything we do is aimed at stimulating failing brain cells, everything. And if you think the live music, we know today of the importance of music. Apparently, we are at our highest psychological energy at the age of 15. So if we get our musicians to play music from roughly when those people were 15, that creates that memory of how they felt at the age of 15. And for a little while, they can feel that and feel wonderful. And their carers can witness this with them. So we have live music at every event. Sometimes it's a solo person, like Eric Glover, he plays his laptop for us. Sometimes it's a band that comes and plays for us, on different occasions. The other thing about the music is that even just playing the music will stimulate the brain cells. But if they actually tap, or if they play a little drum or any instrument in tune, that stimulates many areas of the brain cell, rather than just sitting quietly and listening. But it's in the involvement in the music. We have the singing, we provide times when we sing, and we always start off with a happy birthday, because everybody knows about happy birthday. And hopefully somebody in the room will have had a birthday in the previous month. And sometimes I think I've gone through a year, and there's some people in a year, and they've never had a birthday in the year. But we just laugh about it. But it does get them seen. Again, it's getting involvement. We have colour. Okay, so you see me in this, so it's yellow, all right? Now, the people with any of the dementias can see along the spectrum of yellow, red, pink, and orange. The other colours, blue, purple, and green, are seen as grey, and they just fit into the background. And the tragedy there is that if people are wearing those colours, and then they touch a person or they speak to them, then the person gets a shock because they hadn't known that there's somebody there. And that's why colour is important. But also for our team, we wear these colours because you have had to have been with the team for a year and heard all the lectures, so that if somebody asks you a question, at least you can give some guidance. And that's why the team wear the coloured T-shirts after the year. So what do? We have the tablecloths, they're bright colours. Ours are checked at the moment, yellow, orange, and red. We have candles. Now, the thing about the candles, when I first started on the first evening, I was going to be so perfect, do everything just as it should be. And I had these little candles, real candles. And what happened was, several of the elderly people, they held their programme over the candles. Of course, they went on fire. That was the end of real candles. So we put the little battery ones now on the table. And we have flowers as well, because that's more colour for people to see. There'll be the stimulation through the fragrance of the meal and the taste of the cooked food, and as well as interaction with other people. Last month, I carried out an evaluation of how the people had felt. There were 51 people there. I asked how they felt about the work of the cafe in the last year. And with everything we've done, with all the money we've spent, and all the cooking and all the rest, there's only one thing anybody ever mentioned, and that was company. So this, it really does matter about seeing other people, meeting other people. Interaction. We have education from specialists who are in clinical practice today, and mainly from the Alzheimer's Society and from the NHS. Now, why I do this? Yes, you could find this out of a book, but it doesn't have the same impact as from somebody who's in practice. When I was at Midwifery Teacher Training College in 1982, the head of that college happened to mention to us that she knew consultants who came to give lectures to the midwife teachers, and they gave the same lecture that they had given over 9 years. Now, can you imagine anywhere in life where there have not been changes in the 9 years? So it is. This is why I insist that the lecturers are working today with the people in the community, so that it's real, and the people will feel it's real. Oh, of course, yes, I've said we signpost to the other services. We all know that having dementia, whether it's yourself or your family, it's costly. People are often hesitant to go to ask for funding, benefits that are available to them. And it becomes quite a challenge to encourage them to go to the CAB to get help with these forms. They can all speak English, they can all read English, but I don't hope there's nobody here from the government. These forms they're drawn up so that they can be interpreted in different ways, you know? And one of the things that is asked, can you cook your dinner? And this is at their assessment. And the person will say, yes, I can cook my dinner. But unless you know about this, about what goes on, nobody's going to ask, tell me how you cook your dinner. And they say, go to the fridge, take out the packet, take off the cellophane, put it in the microwave. That is not cooking, okay? And that does not count as cooking, but that can affect their funding as to how the forms are filled in. And so we recommend that they either go to the CAB or they go to a nursing sister in their surgery to go over the forms with them, so that they will have the greatest chance of getting what funding is available, because it's there for them. Right, so we keeping in touch, phone calls I mentioned, but the 5 members have been doing this. Now, because we're back to face-to-face meetings, that number is reduced, and some of the people don't require this anymore. But they know that they can phone us at any time if they want to discuss something. We have training days. These are, it's for some NHS staff come, nursing staff from other nursing homes, carers, and actually for anyone interested in dementia. So we send around the posters to the various localities, including the supermarkets, so that people can come. And they'll be learning from Gemma Jones. For the volunteers, well, one of the things that I am is I'm a part of the Westminster Forum, and I'm allowed 5 free sessions in a year, and outside that, I pay for the transcripts and the recordings. And these are all shared with our team, with permission from the speakers. So that, yes, it's about new ideas, but what is the term? Being forewarned is forearmed, and at least it can be prepared for things that are coming our way. The Westminster Forum, it's an advice group to the MPs, for me, on health matters. There are many, many different fora, I should say. So then, where do we go from there? For what do the carers then get? Well, it's a place of safety and relaxation. It's respite for 1 evening a month, and 1 evening when they don't have to cook. It's education and understanding to enable them to provide the cares they would wish. An awful lot of what we work on is ordinary human politeness and respect and kindness. And if the carers can understand what's happening in their person, then they can use different strategies. Like, we should never ever say to anyone with dementia, do you remember? Or don't you remember? Never ever, because they cannot remember. So you rather divert their attention in another way. But there are many different ways of communicating that will maintain the relationships. Of course, for the carers, they can witness pleasure in their loved ones through watching them during the music, through singing, and the armchair exercises. Now, that was a happy incident. 2 Christmases ago, one of our staff was leaving his employment, and we wanted to throw a party on Zoom, but to throw a party. And one of the members teaches Tai Chi and yoga and all these things. And she suggested coming and giving an armchair exercise session. And my goodness, did it have an effect on us as the team members? So immediately we put that into the next Zoom meeting for the carers. And okay, it loosens up their muscles, but my goodness, it loosens up their tongue as well. It's after that when they chat, they have fun. We have dancing occasionally as well. And for people who are very fond of, ballroom dancing, we recommend that they go to the U3A because they have dancing sessions at St. Mary's. So, and people have fun there. And for those in any of the dementias, they have company, they have sharing laughter, they have tasty food, the beating time to the live music, of course, and the singing. So it's positive for everybody. Maybe different, but it's positive. And these are some photos of our sessions. So that's one of the little bands called Moonlight Foxes. And the lady in the right in purple, she's with the Alzheimer's Society, and she teaches on some of our sessions as well. Down the left, they have a buffet supper, people helping themselves. The summer social, where they had their ice cream, as well as their meal. They had armchair exercises, and that, as I said, that really does work. And then the man with the pan cookery course. Now, the man with the pan cookery course, some of those men, they were given the opportunity to continue with us after the course is finished. And some of them now, 4 of them, have decided, they stay with us, and they come and they serve the food now. They would like to be cooking it, but at the moment we can't do it. But they actually serve. And their great strength is that they make people laugh. They're cheeky, and they, and joyous with the people. And so they raise the level of enjoyment in the room. And as we start off the sessions with food, then they're setting them off to be enjoying themselves for that time. And then we come to another, That's some of our team then, with the High Sheriff, Jim Glover, and the Mayor, Dan Adams at that time. This was a commendation to us for the work that we were doing. Because as I said, we have a large team, and all with their special gifts. We work well together, and we know what each other can do as well. But we're also able to step in if somebody doesn't come for one reason or another. And then there's one picture of our monthly meeting during the pandemic. And on average, I know it's only 18 there, 12, 15 there, but on average we had about 23 on each of those Zoom meetings for the 2 years. And we were all strange at the beginning, and strained, but then people began to relax and they could chat, even though it was through Zoom. Yeah, that was us. So, funding. Now then, this is about asking you. We're continually looking for funding opportunities to enable the cafe to be run each month and any workshops. And these are some of the funders below. But, the big but here, that's important. But in planning, I tend to look at the the distance planning. One of the things that's really needed in the world of dementia care is continuing care by the NHS, continuing plan of care. That is not there. But that needs, and I know you people are the people who, you make the policy, you decide policy. Maybe over time you can feed this in about trying to get continuing NHS care for the families. Because what happens is they are given their diagnosis and then they're sent back to their GP. Now, how are they to know when to go to the GP or not? And it's very frightening for the families. My sister was in this situation with her husband, and she even now will speak sometimes about the terror she felt at being left responsible on her own and not knowing what to do. So they do need, even if it's only for the carers, that somebody is keeping an eye on their person who's not emotionally involved. So please, will you think about that in the future? Hello. So that was my main aim in coming to speak to you today. And that, do you remember last year, 3 years ago, I was going to run a course with Gemma Jones for the councillors. Well, the aim of that was to try to convey to you the importance of getting long-term care. And I don't mean in a nursing home. So come for a visit. We'll start this month in St Martin's Church in the Upper College Ride in Camberley. We've moved from St Mary's. We did give them an afternoon when we had tea and cake for everybody who could come, who would like to come, just to find bearings, to find what the place is like, to find where the toilets were, all the rest of it. And we had 41 people who came. And they've had fun. And there was that lovely warm atmosphere which they'd had at St Mary's. So they brought that with them. And it was nice to see. I was afraid the atmosphere wouldn't come. And David Reid, our treasurer, was afraid that the people wouldn't come from the St Mary's area. But it didn't work like that. Both were wrong. So we have it on the third Monday of each month. I was asked also to draw this to your attention, that now we've started a Memories Cafe to be held at High Cross Church. Now that will be held, come and join us, on the fourth Wednesday of each month from 2 to 4 o'clock at High Cross. So that, if you like, in a way, ours is the third Monday of the month. This will be the fourth Wednesday. So there'll be the opportunity twice a month when people can come and discuss or just chat or whatever, certainly in the Memory Cafe, yeah. And it's to let people know that this is actually available, because it's hard getting the word around. Because for a few months it was run at St Martin's as well, and maybe one person would come, or maybe a couple would come, and that was all. And we know there are more people in the area who need the help. So that is me then. And have I taken 10 minutes?
Maureen,
Sorry.
that's absolutely fine.
Sorry, Vivian.
Thank you so much for so much information and for everything you do for the people in this area. You do such a lot along with your team. Yes, I'm just trying to think of, I know you're on Facebook, of getting these messages across on these meeting dates and everything, so we can have further chat on that.
Thank you.
I'll take questions from the councillors. Councillor Deach?
Hi, Maureen.
Hi.
So, as you know, I'm a big fan of your work and everything that you guys do. First of all, I just want to thank you for on behalf of the community that I represent. I know for a fact, because I've spoken to lots of residents who have benefited from your services. In fact, I've referred people to
Thank you.
your service. There's one particular gentleman I can think of who, sadly, his wife passed away. She had dementia. She passed away. And obviously it's a generational thing. But he literally could not cook a single thing for himself. I know my dad, who's in his 80s, wouldn't even know how to burn toast. But the Man in the Pan project transformed his life. And I know to this day, and that was quite a few years ago actually, and I know to this day he takes a lot of joy out of cooking and everything, and that's all thanks to your service. So thank you for him, on behalf of him and every other service user. Now, I always ask presenters that come here, what can we do for you? Is there anything that this council can do to help you? And you were very clever in saying that at the end of your presentation. So funding being one of them, and some perhaps lobbying of government on the NHS. I think that's something all of us could help you with there. To lobby our MP, maybe facilitate a meeting with the MP, and so on. I know that Surrey County Council have some part of responsibility through the adult social care. I was very pleased to hear that you had a positive experience with that service.
Oh, yes.
I know it's had its problems over the years, but it has actually come a long way in resolving a lot of those, so that was very good to hear. Perhaps there's something we can talk about after this meeting about exactly what it is that you need from the NHS and then we can see if we can move that forward for you.
Can I just say
course.
here,
Yeah.
because as I said, I do go to the Westminster Forum. Now, on a number of occasions that I've been there in the last few years, when there has been a health issue, a real health issue has been discussed, they actually quote Frimley Park Hospital as excellence.
Oh, that's
and
good to hear.
that is for the whole of England.
That's
That we
very-
hear that.
Well, that's very good to hear, Maureen. But if there's anything there, if there are any gaps that you feel need plugging or whatever, more at a more hyper-local level, then I'm sure that's a conversation we can all have afterwards. Now, finally, every councillor here has a members' community allocation. I forget what we call it at this council. Ward councillors fund. I'd like you to email me and ask for some money
Thank you.
out of mine.
Thank you very much.
You know, and if there's any of these projects that you're working on that need money, I'd love to give some of my up for that. And I'm sure there are other councillors here who I'm sure you could twist their arm for the same. And yeah, and like once again, thanks very much. So there's just one question I would like to ask you though, and that is, what are you, you know, it's fair to say you're not going to be able to do what you do forever.
Yes.
Okay. Is there a continuity plan? Have you got people within your organisation that will take over, are trained up, and are as passionate about this critical service as you are?
I'm trying what I'm doing at the moment is that to try to get people used to this, instead of me attending all meetings now, I give ownership, if you like, for certain committees to certain people to try to get them used to going and speaking about what we're doing as well. That's at the moment, that's what we're doing. We're trying. Because we need people to be able, you know, I could be knocked over by a bus tomorrow. I could go down with COVID. So,
Absolutely. Okay, well, thank you very much. Really appreciate it.
you're very welcome. You're welcome.
Josephine?
Thank you, Chairman. Oh, I'll trail this across so I haven't got to reach. I have met Maureen on odd occasion, or on a few occasions, and I think on one occasion we met, and it was at St Mary's Church Hall, and there was a huge number of people there, and it must have been an anniversary of your organisation, because I definitely remember the cake, because I mean, you have to remember important things, and you had this huge cake, and everyone was having a whale of a time, and you had a man with a pan there, and everyone was engaging with each other, and I thought it was such a brilliant organisation. I didn't realise David Reeve was involved, because I'd met him through helping someone I knew on the debt advisory thing there. He helped them enormously. So I know that he also does a tremendous amount of good work, and I think the borough should appreciate how much work you actually do. So thank you very much.
We would like to do what we would have wished had been available for our own families, you know. And when I started off, it wasn't easy at the beginning. For one reason or another, it wasn't easy. But I kept one thing to the fore of my mind, that if I could help one family avoid what happened to us in a year, that would be success. Just one family where they didn't feel the stress and the fear that we had. So
I think,
kept
if I may
this-
just say, I think it's all about making a difference.
Yeah.
All of us should be aware of that. If we can just make a difference to one person, then this world would be a better place. Thank you.
Thank you.
Hi, Maureen. You know you're one of the most admired people for me, and what you do is absolutely amazing. But what I'd like to say to everybody here, if you've never attended a lecture or a training course that Gemma Jones has given, you should. She is absolutely amazing, and she just changes the way you think about situations and feelings. She actually had me in tears in the lecture, not because she was in your face or anything, but she just got you to think about things that you wouldn't normally think about. And when I had elderly parents at the time, and I thought I was not doing enough and she tells you, well, she doesn't tell you, she just makes you think in a different way to be able to help people with Alzheimer's or whatever. The other thing is The Man in a Pan. I bought one of Robin's books a few years ago. I gave it to an elderly neighbour about a year ago, and he can't do without it now. And it's helped him amazingly. When his wife died, he didn't even know how to boil an egg. And I sort of sat with him, we went through it, and he shopped differently, and he does things differently. I'm still trying to persuade him to come to your Alzheimer's cafe, but he says, no, I haven't got Alzheimer's, I don't need to go. And I keep trying to explain to him, it's not if you've got it, it's just the company. So I'll get him there. But just like to thank you for everything you do. And as I say, if you get a chance to go and listen to Gemma Jones, go. She is amazing.
Oh, sorry. Yeah, I have enough money to run the cafe for the year. I don't have the money to run the courses. That's where I'm stuck at the moment. But we didn't know what was going to happen. You know, last year I didn't apply for funding because, you know, it was all on Zoom or phone calls. That was all. But now things are different. So I'm starting to apply again. But yeah, we'll get Gemma along. She doesn't live very far away. She lives in Sunningdale, so it's easy for her to come for the day. She doesn't have to take a plane to get to us.
Yes, I have to say, I have heard her a couple of times this year, as Valerie said. She's absolutely brilliant to be her company. Louise?
I just wanted to add that we do have a link on our website for the grants. At the end of this meeting, I'll make sure I email you so that you've got a link to our website where those grants are. So I'll send you a link on an email for the grants that are currently available on the website. Okay.
No. Yeah. Thank you so much, Maureen. It's been a delight having you here, and hope to see you again soon. Thank you. Thank you very much. We'll turn now to item 6 on the agenda, which is the Frimley Clinical Commissioning Group, and we've got Tom Lawler here tonight to speak to us. Thank you very much, Tom.
So, yeah, pleased to be here. Thank you for... Oh, I didn't make that all go off, did I? No, there we go. Yeah, thank you for asking me to come here. It's a difficult act to follow. It's amazing all the work that Maureen does do and the guys at the Alzheimer Cafe. And I now have to come and talk to you about the changes for the health service and clinical commissioning groups and things like that. But I'll do my best to make it interesting. And hopefully you'll see the reasoning around the changes and what the hopeful difference it will make to the people who live within Surrey Heath. Thank you. So you're probably aware of the Health and Care Act that came into being this year. It's meant some fairly significant changes to how the health system is set up, really with the aim of closer collaboration and helping put some framework and structure around enabling that collaboration and that integrated working. We've been working as systems for a while now, but it's always been, the structure hasn't been there behind it to actually enable it to maximise the impact of that. So integrated care systems have now been formalised, that collection and the partnership that happens across the Frimley Health and Care System. That is a formal entity now. And the aim, as I say, is to bring together the different partners, the NHS and local authorities especially, to focus on those wider determinants and different determinants of health. The NHS has realised that we can only influence a certain part of someone's health. It's actually where you live, you know, your education. All these different factors are what's just as key to having good health and living as long as possible in good health. So these changes are attempting to give some structure and to allow that framework to enable the those to support those changes. I will go into a bit more detail about what that structure is, just so people know. And I think one of the key things for me is that actually the smaller geographies, place is really important. So I'll talk about place, and by place, I personally mean Surrey Heath. And actually understanding the people who live within Surrey Heath, understanding the issues they have, what works, what doesn't work, and locally putting changes in place to make that better is one of the outcomes from this. There should be more flexibility to do things locally. There have been changes to how we procure services. Previously, we had this real strict framework that we had to go through it to procure any new service. And that actually stopped some of the smaller organisations, some of the voluntary sector, being able to access and provide services. And they could be well placed, but because they didn't tick all the boxes as part of the procurement, they weren't able to get the funding and do that. So again, this is aiming to improve that. So moving away from competition and moving more towards collaboration and using existing organisations to help facilitate that. All with that endpoint of actually the population's health and the experience of people who use the services to improve. Thank you. So it's quite a busy picture, this. I think just wanted to include it to illustrate all the different partners who are involved in the integrated care system. The observant among you will see Surrey Heath Borough Council there, and all the other partners. And then there are 4 new parts to that have been set up: the Integrated Care Partnership, the Integrated Care Board, place-based partnerships, and provider collaboratives. I'll talk about a few of those to illustrate what the changes mean and how they can facilitate improvements in the future. Perfect, thank you. So one of the most important new entities is the Integrated Care Partnership, or ICP. I think every time I speak, I always say the NHS loves an acronym, and yes, it doesn't exist until we have that, so the ICP now exists. The key thing here is that this is the approval body now for the integrated care system, so the priorities we have, the work we put into place is approved at this particular body. And as you can see, the local authority presence on that is very great. And actually, it's an equal partnership between the NHS and local authority. This to enable that understanding and those changes for those wider determinants I was talking about, that creating the healthier environments is what is important here, and this is to help facilitate that. So I was introduced as the clinical commissioning group at the beginning, and actually clinical commissioning groups don't exist anymore. So one of the important things to get across today is that one of those changes is that clinical commissioning groups have gone, and something called an integrated care board now exists. And that is made up of the clinical commissioning group, some of these services that previously sat with NHS England, that's pharmacy, optometry, dentistry, and some of the other stuff that was going on within the integrated care system now is part of that board. That really is the structure to take on the statutory duties and functions and funding that goes through the NHS, and it's to work closely with the Integrated Care Partnership and the ICS to make sure that the right changes happen. Yeah, if you go on to the next one, please. I think for Surrey Heath, what's key is that the integrated care system is still made up of 5 places, and we put 5 successful places, and I think that is very true. We are one of the top performing ICSs in the country, and part of that is Surrey Heath, and I would say this, but it's the most important place within the ICS. But the part of what I wish to be the aim of these changes is to help enable that change and the driving of change at a local level, using those partnerships that we do have, but facilitating and bringing them closer together, and making sure we get the right services in place for the residents. I think it's important to say as well that The CCG team that worked in Surrey Heath has shifted across, still works within Surrey Heath, so the faces, the people are still here. And just as importantly, the health provision hasn't changed. So the 7 GP practices that existed are still here. All the good health services, both for adults and children, are still here, still available. It's some of the structures around that that have been part of the organisation that has been the changes. So that was what I wanted to talk around the changes to the health system. I think the key things, as I say, is that CCGs have gone and we've now come up with these new acronyms, the Integrated Care Board and Partnership, but really there to help with that collaboration and integration. And then I just wanted to finally talk about some of the work that we have been doing, which is hopefully of interest. So the COVID vaccination service in Surrey Heath, it was previously being completed out of the Lakeside facility up in Frimley. It's moved to the square in Camberley, so it's now in the centre of Camberley in one of the old shops in the mall. It was opened in August. The mayor came along and opened it. It's been a bit of a soft launch. I think we are moving into the big bulk of the work in the autumn-winter period to make sure everyone has their booster, or everyone who's eligible. But it's been a really good example of working together with partners. The Borough Council has facilitated finding the estate, the site for it. The Primary Care Network, which is the group of general practice surgeries working together as a network, they deliver the majority of the work there. But it's supported by lots of partners, including the voluntary sector. And it's really pleasing to say that actually that work that happened at Lakeside was granted an award. It was one of the regional winners for a parliamentary award. It went through to the national final, I think, just to really show the great work that has been doing and the novel work that they do in that partnership that we actually have. It's also another good example of bringing healthcare closer to people, so health in the high street. So we are wanting to look at how we can make things as accessible as possible to people. And the centre is actually being used to run some cardiovascular clinics, so measuring people's blood pressure and some other characteristics to either identify if people have got an underlying undiagnosed condition, or if they have a diagnosed condition, and actually helping them to manage that in the best way possible. Thank you. And then I just wanted to say about the partnership plan that's been put together. We have built upon the great work that the Borough Council did as part of their consultation with the community, and used that rather than doing things separately. We came together, if that makes sense, to use that to come up with a combined plan that is aligned between the different organisations that are there, illustrated at the bottom right-hand corner. So from all the different elements of and organisations that support people in our borough, to come up with a number of focus areas where we think by working together we can make a bigger difference than if we were working separately. And actually we shared those plans that we each had, and there was a lot of alignment across that. As you can see, we probably are wanting to make the similar changes and have the same issues that everyone else does. And if we move to the next slide, please. I won't go through these in great detail, but there were 6 priority areas that we've decided upon for the coming year. And I just thought it'd be useful to share those with you, because hopefully it may trigger some thinking about where we could work together, or if it's things are already happening. It was interesting when we shared those plans that actually we were doing lots of stuff in isolation, and actually by bringing it together we could see there was synergy there, and we can make a bigger impact. So those 6 areas, one of those is around areas of deprivation, and trying to help the people who are less advantaged to have a good start to life, have the right things in place. There's lots happening there, and there's a real area where we're doing lots, but it needs to come together and support each other. We're looking at people where English is their second language. There is difficulty accessing services that are available, and that's probably an area we can do a lot together with and make better. Safe and affordable housing, that's one of those determinants that really makes a big difference. And health hasn't really looked at that very much. There's lots of work happening, and that's another area we are going to work on through the year. Mental health and well-being for children, young people and working age adults. We have made some good improvements around mental health support for older adults and having an integrated team around that, but there's an opportunity there for other age groups. The healthy weight is the work that the Borough Council are leading around obesity, and then workforce is a big issue for all partners involved in supporting people. So wanted to make Surrey Heath that desirable place to work, to attract people, retain people, and work together to recruit and retain those people. Just one final thing, if I may, just to say what we're doing. We have a public engagement event happening on the 1st of October in Camberley Theatre. There's going to be communications coming out, but I thought it would be a good opportunity just to share that it's happening. I wanted to use it to talk to the public and listen to the public about access to services. There's lots of media coverage about GP appointments, and we want to have that conversation about what is possible, we are doing to help facilitate people getting an appointment, when an appointment is appropriate, and the time frame you might get that. So I wanted to use that as a plug to get people along, to use that to be able to have that conversation, to hear what we're doing, but also to hear from the patients and public as well. So that was everything I wanted to go through, so thank you for the time, and I'm sure you have some questions.
Thank you very much for that. Very interesting. Such a lot involved there, Tom. I understand that we have got the slides, so we will arrange to have them sent out to the members of the committee. I will take questions for Tom now, please.
Thanks for that presentation. It took me years to get my head around CCGs. Now I've got a new thing to get my head around, but that's fine. Obviously, which you alluded to right at the end of your presentation there, the thing that's on everyone's mind, and I think we as councillors, cross-party, get communication about, is GP appointments and so on. I have to say, though, from a personal point of view, and you know, my experience of the way that they now triage over the phone and all the rest of it, for people who are relatively fit and well, like me, I think that works really well, actually. And I've been able to get all the care, my family have been able to get all the care that they need. But I do recognise that, you know, there are members of the community who actually get very anxious that they can't get an appointment, and they have to sometimes do the Krypton factor just to get an appointment. But anyway, the question I wanted to ask you was, and it's actually, I think I asked the same question whoever it was that gave the presentation last time, and that is that, you know, when we talk to residents from a planning perspective now, so on housing development, the number one thing everyone says is, yeah, it's all very well, all this development, but what about infrastructure, right? We can't get appointments at the GP and blah, blah, blah. Now, there's a thing called infrastructure, a community infrastructure levy. And I asked the person last time, I can't remember who it was, you know, do you ever make a pitch for some of that money? You know, maybe you need I don't know, a podiatry clinic building or whatever it may be. And to my knowledge, I've never, because I'm a substitute member of the planning committee, so I don't attend all meetings, but I don't think I've ever seen anything come through or read an agenda that says, yeah, well, you know, there's something here on the conditions to give this through the representation through community infrastructure levy. So do you ever do that? I know you're a statutory consultee on things of planning nature. Do you respond to them? And if you don't, I think you might be missing a trick.
It's a very good question, and in the past we have missed that trick, but we are starting, we've learnt, so, and it may have been that question has stimulated it, but it certainly helped, but yes, we now have the contacts, and we are being part of that, and actually there have been some changes to some of the surgeries in our area that have been facilitated through some of that development. It could possibly have been part of Guildford rather than here, but yes, we have. So I think it was in the Ash part of the patch. So yes, it's a really good question, and yes, we do, and we know we do need to facilitate that. The problem is the amount of money needed to create a new GP surgery is quite major, and then how we actually then fill that with doctors. But what we have done is use it to get more clinical space with the existing infrastructure that we do have. So it is welcomed, and we are trying to use it and make the most of it.
Can I have one more, please, Chairman? Great. One particular hyper-local issue to my own ward is that the Bartlett practice of surgeries and the Frimley Green Medical
Yes.
Centre in
Yep.
particular, because they stopped being a dispensing GP, so you could get your prescriptions literally at the surgery there. And they stopped that for some reason, and I can't remember why. And because the Boots pharmacy in Frimley Green is the closest one, people are literally queuing down the street, and it's causing quite a lot of anxiety, particularly with elderly residents who might need their prescriptions and so on. Is that something that you guys can influence in any way or alleviate in any way? I don't know whether it comes under your area of responsibility, but it would be interesting to hear your views on that.
Again, yes, it's the community pharmacies come up often now. The issues there that they are having the same issues around staffing and are having to close just because they're understaffed and it's not safe for them to do so. We have been able to have some influence in the past, and that is actually increasing, because one of the slides I did talk about, we actually have some responsibility as an ICS now. We have some responsibility around pharmacy. So we do actually hold the contracts and probably have a bit more influence. So it is something that's been flagged, something we're trying to improve on. The difficulty is that, you mentioned Boots, these large multinationals, the national players, they're far harder to influence than these smaller one-man band family areas. So
if we get inquiries from residents about that, do we ask them to write to you? What would you say is the best course of action for us to signpost a resident in that
no, I wouldn't
regard?
write to me personally.
I meant the ICB.
Yes, yeah, absolutely, yes, yeah. That's now, we now have the responsibility, so it would be. Now, you might want to, it's probably, they are independent contractors and independent businesses, so we have some influence, but we can't completely change what they're doing, but yes, we can help.
Perhaps Louise would distribute contact details to members. That would be okay. Great, thank you.
Any other questions? Yes, Morgan.
Thank you, Chair. I was just really pleased to hear regarding the partnership work that you're doing, especially with housing. And obviously, I think, as you mentioned, housing is a major determinant of health. And I was wondering if you could explain a bit further on the work that you are doing, engaging with organisations like Accent to ensure that the residents in Accent housing, which sometimes are often more vulnerable, sometimes more sceptical of going to a GP practice or seeking medical help. I was just wondering what kind of outreach work is the ICB doing to kind of encourage that? You did say you have a public event. I'm just wondering, do you kind of do roadshow events to go around the borough or to go around the area that you cover? I'm just wondering if that's something you would consider, and also if you could just give a bit more detail in the partnership work that you are doing, just to get a better understanding of that.
Sure. So in all honesty, we're at the beginning of that partnership. So it was I think the last meeting we had of the Surrey Heath Care Alliance, it was the first time that someone from Accent had been there. So it's early stages of that working together. It was shown to be an area that needed focus. So there hasn't been loads of work that I can tell you about, but there's the plan to do some work. We are looking at how we can better outreach with services. That we have had a minivan going around to deliver COVID vaccinations, also do some of the blood pressure testing. So we're looking at how we can do that differently. And if there are particular issues, we can look at, sharing how best to access. It depends, I suppose, is it the medical care needed or the how to access medical care? And we are putting in different types of roles. So there are people called social prescribers, health and wellbeing coaches. They may be the right sort of people to help support people to access the right support and services, be that the NHS or social care or CAB. So it's at early stages, I think. And yeah, and if you have any particular questions or comments or you think we should do, please, I'll be pleased to know so we can help build that. And we have been working closely with the borough housing team and Clive and his team to help the people who are at risk of being homeless.
Any other questions to Tom? Yes.
Hello, sorry, I'm just going to shout now. Going back to Councillor Ditch's point about the pharmacy from the Green, would you be able to make a note to have a look into that one, please? Because as Councillor Ditch said, the queues and the waiting down there really are causing. I'm assuming that Paul's also received that people are waiting out there for hours. Particularly, the complaints were particularly when the weather was very hot and people were literally, because they still won't allow people in, the queues are literally going round the block. And there were, for example, there was a gentleman who called me to say that his wife needed medication and they kept saying they were going to have it. 4 days on the trot, he went and stood out there for over half an hour because they kept saying that they were going to have the medication and of course it didn't come in. So would you be able to have a look into that one specifically, please?
Yes, I can. I'm sure we are aware of it because there are issues with a number of the pharmacies, as I say. I can look into it. I can't promise that something will suddenly change because, as I say, that we have influence over them, but we can't suddenly make them, put on extra staff or have the drugs in on that particular day. But yes, happy to look in and do what we can.
I've got a question for you. I've got some notes as well. Life expectancy is a key indicator for health for all reasons. And within this borough, we do have differences in communities, and different wards have different problems, but particularly with life expectancy. It is a key component of the government's levelling up policy to close that gap. And life expectancy in life, partly by improving life expectancy in these disadvantaged areas. And can you comment in Surrey Heath what is being done to try and close those gaps in these said communities? Thank you.
So that's a quite wide-ranging question. I think it's difficult to say everything, but yes, it's certainly an area of particular focus. There's quite stark differences, actually, as you say, between different wards. There is work happening across the whole of Surrey that actually have allocated a number of priority places or geographies, and Old Dean is one of those, and also down Ash Wharf. And we're also looking at putting in additional support for St Michael's and Watchet as well. So I suppose the difference in approach is working with the communities and building on the strengths that they do have, and rather than doing unto people, actually going and understanding what works for them, how we can help and support. There's some new roles that have been created to help facilitate that as well, and to have that conversation about what we can do. And we do have some funding available if there's particular interventions or services that can help with that we can do. So I think it's building on what we already have. There's lots of really good stuff that is happening in all those areas. So it's not radically adding to it. It's building on what we do have, and making sure that they have the right support in place to maximise what they're able to do. If that answers the question.
I mean, this is very good to hear, and that you are building on what's already been happening anyway. And I'm sure the councillors that are here will be pleased to hear that you're actually mentioning that, Tom. Right. Well, can I thank you very much for coming here tonight? Very, very interesting stuff that's going on, very important stuff. and to all the people that are involved that you work with. So as I said earlier, that we will make sure that the slides are sent out, because a lot of important stuff on those slides that you gave us, I think, there. So that they were coming out to the councillors. Thank you very much again for coming. Thank you. Item 7, and we are to receive a presentation from Accent Housing. Welcome to the committee here tonight, and pleased to see you here. So can I put it over to you, and then again the councillors can ask any questions of you. If you'd like to introduce your team, thank you.
Evening, everyone. Okay, so yes, I've brought a few people here tonight because I think it's important you guys get to see what we're trying to do here and achieve. So my name's Edith Shaw. I'm the Director of Property Services. I've now been with Accent for 4 months. And we've got Adam Rickard here, who's been with us for, this is his 2nd year. He's the new Building Services Manager for Camberley. And then we've got Louise. Louise started a week ago. And Louise is the Director of Customer Experience. And then also, who isn't here tonight, which I think it's important to share, because I believe Julie has said that we want to get people on board that have the skills and the knowledge to work with our customers. So we've got a gentleman who started as a repairs and void surveyor called David Print. He started about 4 weeks ago now, and he's been working really hard. I've also just employed another gentleman called David Wills, who's also coming on as a repairs and void surveyor, and he's got over 25 years of experience in social housing. So we're building the team up. Also tonight here is Ian Williams, representative. This is Anthony Pycroft, and he's the Responsive Operations Director. I need to put my glasses on, sorry. Okay. So at the moment, we've got approximately 1,000 legacy jobs still outstanding from Axis. Ian Williams have focused mainly on the current demand with the planned works and some of the new contractors assisting with, we've got some other contractors assisting with all those legacy jobs. We are looking at the roofing jobs. We've got winter coming. Not going to lie, it has been a pretty painful process. We've got roofing contractors now. Accent have brought roofing contractors on, and Ian Williams are also getting their own contractors. So all roofing repairs are due to be complete by the 31st of October. We've got quite a number of outstanding fencing jobs as well. So therefore, we've brought on another maintenance contractor as well. And they're going to assist with the legacy jobs and the jobs that are coming through. We won't be letting these contractors fade out until we know we can service our customers properly. And there is electrical legacy repairs, and there's 1/3 of those complete. Now again, with the electrical, this is an area that I'm conscious where we've got legacy jobs or we've got jobs outstanding over 28 days, that those are cleared. So I have spoken and brought on, we have a contractor in this area that deals with a 5-year electrical test and the remedial works from that. They're also now looking at taking on the electrical works for our residents. So this is to assist and aid Ian Williams. There's some figures here for you. And I'm not here to dress it up or anything. Yes, there is still some issues. Routine completed within 28 days. That's dropped slightly, hence the reason. And I'm sure Anthony will go through some of the explanations on that we've brought on additional contractors, because there's no point in me working with Anthony and beating him over the head with a stick when he's trying to get the staff to do those works. It's important for me to make sure that our customers are getting a service, and the way that I'm doing that is by helping Ian Williams bring on my additional contractors to support with that work. And obviously, I'm going to open the floor out.
Yes, Josephine.
Thank you, Chairman. That was very interesting. I haven't had a lot of dealings with Accent, just sort of a couple of things locally, but I wondered if you can help. We've recently been contacted by a gentleman who he's had COVID in 2020. He lost his job. He now has no work. He is ex-military. He served 4 tours of Northern Ireland during the period. In 2004, he suffered 2 heart attacks. In September 21, he was diagnosed with leukemia. He cannot get a job, so therefore he is unable to pay the rent for the flat he currently has. At the moment, it looks like he's going to be sleeping rough next week because he just cannot get help from anywhere. Are you guys able to help in any way?
Hello, I'm assuming this is somebody who is not a current tenant of Accent.
No, because I said he had a private flat. He's about to lose that. I did ask one of the officers, and they suggested I contact you guys. He just doesn't know where to go to. Because he cannot get a job, he cannot pay his rent, and so he is going to become homeless. You know, he has served his country to the best of his ability. He now has nothing, and I think, you know, he has not been with Accent before. I don't know how the system works, but I think, you know, are you able to help him?
He certainly sounds like somebody who could be one of our residents. However, we take our nominations for housing from the local authority. So we would, unfortunately, that means we can't take a direct referral from the gentleman.
He's not a resident. He's not with you. It is a private.
Yes,
thing.
so he would have to approach the local authority, and it is actually, we take our nominations from the local authority who assess the need for housing.
If I can come in, Louise would like to speak on this.
I'm actually going to ask Nick Stevens. Do you want to come and speak?
I'll speak loudly if that's okay. If we can have a conversation afterwards, I'm not sure which officer you've spoken to in the local authority, but clearly we can have accommodation for this individual with a view to then finding more permanent accommodation for them.
Thank you, Chairman. Hello. I have to say, so I have 1,000 still outstanding from the last time that we spoke to you. I'm pretty disappointed with that, if I'm honest. I think that it was starting to show signs of going in the right direction last time you were here. I can't remember what the figures were. I don't know if anyone else can. 1.5. Was it 1.5, was it? Right, and yeah, and then you got that down, I think, by 200 from then, if I remember right. Yeah, that's pretty poor, if I may say so. I don't know what's going on with you guys. I see your vans out all over the place. But I don't know what to say, to ask you to get a shift on, really. We're getting close to the winter. Funnily enough, I've not had an inquiry for a little while, and I just by pure coincidence, got one through today. And I've literally just forwarded it onto the new inquiry email thing that you set up, which has worked quite well, actually, I have to say, for inquiries that I've passed through to you. Seem to get dealt with relatively quickly, which is nice. But this one was on a boiler situation, and I know you probably don't want to go through individual cases tonight, and I don't expect you to, but what concerns me is that there are some more vulnerable members of the community that are caught in this infinite loop of maintenance issues, outstanding maintenance issues. This particular one is a boiler problem. Lady just cannot get you guys to fix it. She's got young children that have just started back to school. They want to be going into school clean and all the rest of it. What can we do to prioritise, particularly ones like that and vulnerable residents, elderly residents, to make sure they get bumped up and dealt with appropriately?
Okay, so Every single one of our customers is important. So bumping somebody up the queue means that somebody has to go below it.
I think you might have misunderstood what I said there. What I'm saying is you know, if somebody needs, I don't know, a railing painted, and there's someone without heating, clearly there's a priority.
And obviously there's different skills in that.
Right.
So we've got gas engineers that deal with the boilers, and we make sure that, you know, and it's not Ian Williams that deal with them, and we make sure we look at those. Now, where there's an incident like that and it needs escalating, we can deal with that and look at the situation and see what's going on there.
And I've sent that through, so hopefully that's what will happen.
And we don't want any of our customers, and that's what you know, I didn't come into housing over 25 years ago to have to sit in the councillors' chambers to be answerable because we're not carrying out repairs. I came in with a passion, and I still have that passion. I don't agree with what's gone on in the past with the repairs situation, and that's why, you know, we made a decision with Ian Williams to say, look, sorry, but you're not fulfilling the contract at the moment, and Anthony will go through some of the reasons why. So therefore, I had to make a decision to bring in. And these are the contractors that we have on board to do our planned works. And I've introduced them to do some of the repairs and maintenance. And yes, we're coming into the winter months, so for me it's important that the heating systems are working. We've got communications going out this month to make sure everybody starts checking their heating systems, to make sure they are fully functioning, because the last thing I want is an influx of calls coming in October when we get a cold spell, and we can't fulfil that. So I want to get that sorted now. So we are starting that communication. Thankfully, Adam's very good on the gas. He's got several years of gas experience. You know, so that's important for me coming into the winter. The roofing, the legacy roofing and some of the roofing jobs. I don't want roofing jobs over 28 days. There's several issues for that with me, and that's disrepair cases, damp and mould, and basically somebody's got a roof with a hole in it, and I've got to get them sorted. So again, those are things that I'm looking at now. Electrical, we're doing that. We've brought in the electrical contractor separately so we can look at those. And we will keep helping Ian Williams until they can, and I'm going to let Anthony advise.
Before you do, if I may, Chairman, obviously across you know, your outstanding jobs and whatnot, you'll be coming back to this committee, what, in 3 months' time, will it be? To report again how it's going. On the current trajectory, what do you anticipate that figure to be? So it's 1,000 now. What on the current trajectory? And I won't hold you to that, but just to give us a rough idea, what do you anticipate? Because by then we will be right in the middle of the winter.
We will, and it depends on what the repairs are. And, you know, our customers. There's some of you know, a lot of our work is fencing at the moment and grounds works. But, you know, I can't predict what it's going to be like in the winter. I'm being completely open and honest with you. I can't predict what repairs we're going to get. What I would like to see is the work that we've got outstanding reduced dramatically. Now, you know, in the northeast, we've got it down to work in progress of about 600 properties, work in progress, which is where I would like to get Camberley, because that is the average, and I would like to see it get down to that. I'm not going to say that's going to happen in 3 months, but we are working towards it. And that's what I'm going to say to you, that we are working towards. I want a reduction. I don't want to be coming here in 3 months' time and sitting in front of you with the same figures. Because it will be me that comes.
Okay.
Thank you for that. First of all, Emma Jane.
So I personally know about this because I actually live in one of your properties with my parents, and the frustration of all the other residents are just the same as my parents as well, because it just goes round and round and round and nothing gets done. There's still repairs on my parents' house that haven't actually been finished as well, as the same as other residents in this borough. So you need to do something with it because it's just getting ridiculous now.
Emma Jane, it's just been pointed out that perhaps you should declare an interest.
Oh, sorry to declare that interest, sorry. But I do know the frustration of all the residents that live in these houses as well, because it's not just one, it's something in every one of them, and it's not on really.
No, and I totally agree with you.
I've been elected, every meeting that we have, you come in, and it's not good, it's not good.
I totally agree with you. I'm not sitting here saying I don't agree, because the frustrations you have is the frustrations I have when I get an email and I receive that the work hasn't been complete. So it's the same frustrations, and I will stick at it, and I will resolve this one way or another.
Morgan?
Thank you, Chair. Firstly, it's glad to see someone from Accent in the chamber. It's been a long time coming that we've had virtual representatives, so I'm really glad that you're here, so I thank you for coming. I've got a couple of points, and I know you mentioned fencing, and I just want to press you on the fencing, because I've had residents from across the borough ask me regarding why the decision has been taken to move to wire fencing instead of wood panel fencing, and particularly, especially on repair works of fencing, that some people have had one section of their fencing fall down, and then it's just been, that section has then just been replaced by wire fencing, which is then, so it's wood, then wire, then wood again. And a lot of residents are very confused by that. I would also press you to reconsider wire fencing, because a lot of people use their gardens as that could be their only private sanctuary, and then going into their garden, they've got a wire fencing which is then overlooked by their neighbours very easily. And also, I've had one resident contact me regarding that the wire fencing is too low, and their dog is able to jump over the wire fencing into the next door's garden, which is obviously causes issues. Also, I'm just wondering if you could tell me how many properties you have at the moment that are unoccupied, and how quickly the turnaround is from once a client leaves that to then is then reoccupied, because I've heard on the grapevine, and I'm not saying this is completely true, but there's levels of that it has to be completely repainted despite the paintwork being perfectly fine, that the carpets have to be completely changed despite the carpets potentially being completely fine. And I'm just wondering, is this just adding work onto Accent's workload when it's not needed? I realise that's a very long point, so it's just regarding on the fencing and the unoccupied housing. Thank you.
So on the fencing, there has been, for some reason, a lack of wood, and wood's got more expensive, and we're a social landlord, and a decision was made, party fencing. Most housing organisations where it is party fencing will provide chain link, okay? We did send out communications to residents to say that we would be maintaining fencing, but we would be going down the route of chain link on party fencing. If residents chose, obviously where you've got the privacy barrier, so you will have one 6-foot fence panel, and then it will be 4-foot chain link, which is acceptable. Obviously, if there's a dog jumping over a fence and that is disturbing another resident, that's an antisocial behaviour issue, and that can be dealt with through the housing management team. But that is the route the organisation has chosen, because also we've ended up in this backlog of fencing because we haven't been able to get wooden panels and what have you. And chain link is slightly cheaper and more cost effective for a housing organisation. So we did send out communications to all our residents, informing them of a change, and that is the decision the housing organisation has taken for the moment. Now, on the empty properties, not every property gets decorated, and quite frankly, not every property should be decorated, because we do have properties that are in good repair order and decoration. I've implemented a new way of working, so we have reduced the amount of properties that we're decorating. Where we are decorating is where it is essential, and that will be potentially on retirement schemes. But again, the question will be asked of the resident, they'll be given an option, do you need the property decorating, or do you want to take decoration vouchers? Because as you know, that, you know, the retirement schemes now are for over 55s. So, you know, there is some people that will prefer to do it in their own taste because otherwise we're painting at Magnolia. So there is a reduction there. We don't fit carpets. If there is carpets in the property when it becomes void and they're of an acceptable standard, again, we will ask the incoming resident if they want them. If they don't want them, we will remove them. However, I get your point, because they were fitting carpets in some of these properties, which was then extending it. And that I've stopped that now, because that is not part of a repair. And if a resident does need assistance with carpets or flooring, that should come from a welfare fund from the housing organisation. It's not part of the void. And that is something, again, that can be done in occupation. Because as you all know, when we all move into our properties, the chances are there's no carpets there and we've got to sort it out, and we get them as we go. And that is something that we need to make sure that we're doing to get our residents into their homes sooner rather than later. The amount of properties that are void at the moment, we have approximately 70 voids in this area that are void. That's not a great position to be in. So what I've also done there is I've brought another 4 contractors on board to turn those around quicker. And again, that's happened in the last month. And what I had to do to bring those contractors on board is do another specification on the property. And I've managed to do that with the new surveyors. But what I've also done as a result of that is I've taken that away from the contractors. So it's not the contractors any longer that are speccing the properties up. They're not doing the specifications any longer. It's Accent staff that are doing the specifications now. And those specifications have to be carried out within the property with being void of 24 hours. And then the works order raised. Now, yes, we've got some catching up to do. And that's hence 4 contractors now on board. So we are working on it.
Thank you, Chair. Just regarding, I've had one resident, just regarding the fencing, and I take your point, I understand why you are doing that. Residents are going to disagree with it, but I think that's maybe an unfortunate reality. The one resident I've had is that they've had one wood panel fall down, and it's been replaced by chain link. And I'm just confused as to the logic of replacing one singular panel with chain link.
Because where does it stop? And where does it stop and where does it start? So one fence panel's come down, but if another one comes down, what do we do? Do we replace that with wood, or do we do that with chain link? So it will all go to chain link eventually, unless the resident wants to change it themselves. But where it's on a highway, on a public path or next to a road and it's their back garden, we will be putting 6-foot closed-board fence panels up. It's the party fence between 2 properties that is the 4-foot chain link.
But do you understand the confusion?
I understand.
Because they will have fencing,
yes,
a gap, and then fencing.
Yeah.
The fencing that they have is completely fine, and the one panel came down during a storm. And obviously this is a legacy order as well. This is not fencing that's come down recently. This has been logged with you for nearly a year. And they assumed when they called Accent, got everything, that it was going to be a wood panel, and now they're being told it's going to be chain link. And they're very confused as why it's all changed. And I think there's a level of communication, and I'm happy to speak. I don't want to bring it up, obviously I'm not going to bring up this individual point here, but I think there could be a much better communication from you to residents regarding that. A lot of people who've come to me are very confused, and they think it's just Accent trying to save money when Accent are failing to do their repairs. And that's the perception that's coming across from residents. I think that's something that needs to be addressed.
okay.
Thank
Emma?
you. I'm going to do the loudspeaking thing again. I agree with Morgan. I also think fencing is becoming an issue. I have had residents who, again, were promised fencing back at the beginning of the year. It was agreed that it was going to be wood. Then there was a long stretched out debate, and eventually you dealt with it, I believe, and it did become wood. However, I, along with many here, sit on the planning committee, and we're often asked, as part of planning applications, one of the considerations is privacy. And I would go as far as to say most of the planning applications that we see, if there was a proposal to put chain link fencing on that application, as a planning committee, it's very likely, and the officers, it is very likely to be declined on the grounds of privacy, which is why, although you say there is that first panel, that is part of the reason why I struggle with that. That is not the standard that is expected within the borough, and that's not, and I do totally understand where residents come from, because as a borough as a whole, when we're building new property or extensions or that's being changed in some way, as a planning authority, we would not find that acceptable. So I do struggle with that a little bit. Now, the other thing that I'd like to bring to your attention probably goes more to Ian Williams. You, Accent, said to us when we were here not so long ago that the change in the new contractor was a good thing. It was all going to change. It was all going to be, you know, things were going to sort themselves out. Well, unfortunately, I have two residents that come straight to mind that that is not the case. Now, I have an email here. I'm not going to go into the details, but I have an email here with a few comments in terms of work that Ian Williams had undertaken. Just very briefly, for the benefit of everybody, this is in connection with a job that's started, was taken over by Ian Williams to do, and is in connection with replacing a driveway that was left with a gap in the middle. So you couldn't use the driveway because you simply could not drive over it. This was left, as I say, by councillors, and I will just read you a few of these comments from this resident. She has obviously been ringing, and I believe Accent have been struggling with this one a little as well. One of the comments she makes, I'm beyond furious now, they've ruined the summer. Ian Williams had taken on the work for my property. They started removing the concrete from the driveway. It was then left for the next company to complete it, obviously, that being part of historic. They turned up on the 9th of August, booked for 2 days, said they couldn't do the work, and disappeared 2 hours later. 3 weeks later, the same workforce returned to remove the roots, despite having said they couldn't do it, and the rest of the concrete, why couldn't they have done that when they came on the 9th? Same people. Then arrangements were made for the next stage on Bank Holiday Monday, so clearly that had to be cancelled. That wasn't going to happen. Then there was various and lots of telephone calls and in-depth information. Then, just recently, a carpenter has been sent along to lay this driveway. How does that work? And in the midst of all of this, there's been an absolute fight that they have had just to the communication is appalling. There are 3 examples on this of appointments that were made that people just simply have not turned up. There's been no notice, just have not turned up. The one last week, in fact, this concrete that was needed for the driveway, the team of engineers were due to turn up in the morning to prepare for the driveway, and the concrete was due to be delivered. The contractors did not turn up, however, the concrete did. So that in itself, the resident then has concrete company looking to tip, and of course they've got nothing to tip in. So that in itself, she then obviously has to turn the concrete away. Some of these contractors have admitted that they're out of their depth. There's a tiler and a plumber who has admitted he's out of his depth, as I say, and still, right now, to this point, this job has not been finished. This lady mentions that in a couple of places over to me, the lack of communication and the way this job has been handled is totally unacceptable. And this from a company we were told was going to replace and be much better than the previous one. And I'm sorry, as I say, this example is just one of 3 that I have at the moment. And Councillor Ditch is actually my ward partner, and he says he hasn't had very much lately. Clearly they come to me because I have.
Makes a change, doesn't it?
So they, and as I say, this situation is, and the others like it, are just not acceptable. These people are vulnerable. This particular lady has leukemia. She's dealing with all of that and a grandson and this situation. And what I would like, please, I would like you to come along and see this lady with me. And I would like to be able for you to have a conversation with her and explain the situation, when it's going to be resolved and why it's happened as it is.
I believe this would be Sturdy Close. Is that correct? Sorry.
We shouldn't be talking about addresses.
Sorry. Can you hear me? Okay, so I understand the address that you're referring to and the resident in question. I actually intend to visit that property first thing tomorrow morning with my contracts manager. Obviously, if you're able to attend with me, that would be great. I can do it later in the day if that would be better for you. But I am I'm here in the region for a couple of days, so I am actually going to that site tomorrow to assess the works that have been done and make sure we can finalise the last couple of bits and pieces that do need doing. Yes, my contract manager spoke to the resident this afternoon to say we'd be on site in the morning. Sure. Yeah, absolutely. That's no problem at all. But that was on my my plan for these couple of days that I'm down here, because I am aware, as you quite rightly say, that the service that particular resident has received has been nothing short of appalling. We've had, as Edith has referred to, we've had a significant number of challenges with mobilising this contract. Obviously, we inherited a number of people through Chupi from the previous contractor, and whether it be from a skill point of view or an attitude point of view or their ability from a customer service point of view, they've not been the right fit. So we've had to churn through a lot of the staff that we inherited. And some have left of their own accord because they didn't feel Ian Williams was right for them. So in essence, we've been in a position really for the first 3 months, unexpectedly, where we have had much less resource than we need to deliver the contract. There's a lot of work ongoing to get that resource in place. Staffing is very, very difficult in the region at the moment. And Edith alluded to the fact that we're working together to move works around where Edith can bring someone else in to support directly for Accent to ease the burden on us whilst we're getting our staffing levels in place. We're in essence, we're building a new team in the region, and that's back office as well as operatives. And it has been really, really, really challenging. Even onboarding subcontractors, which is usually a relatively straightforward process, has been ever so challenging. It's the market demands, the sector demands, and in this region, Guildford, Waverley, these areas, it has been a struggle lately. We are seeing some improvements. Okay, so we've churned probably 50% of the staff or the operatives that we needed to, because they weren't right for the business, and we've replaced those. We've still got another 5 operatives that we need to recruit to get fully manned, to start getting on top of the backlog and to be able to take some of the works that Edith has been allocating elsewhere back in-house. It's not going to be overnight. It isn't going to be overnight, but there is a hell of a lot of work going on to improve our staffing levels and then in turn improve the service. I think communication you've touched on has been poor, and I think some of that is an experience of the team. what we've done quite recently is we've drafted in some management team from elsewhere in the country to support and help the local team here, who are local people who live in the area. And we've drafted those in. We've drafted some operatives in from our Southampton branch to try and keep on top of it. And that recruitment drive continues. And we've had some more success very recently with onboarding subcontractors as well. But it's taken time, much longer than we would like, to get this to filter through and come through. And of course, I think one of the challenges we've had with communication is when you have a backlog the size that we have had, things can get lost. It does become a wood through the trees. So there's with the additional management resource we've brought in, there's been a lot of breaking this down, bite-sized chunks, make sure we know where we're at, make sure the resident knows where we're at, and we are working through that. So, we're not sitting here by any means saying we're doing a good job. I'm not even saying we're doing a half decent job. What I will say is we've worked with Accent in other regions for many, many years, and we work well together and we deliver a good service. We will get there in this region. I appreciate it's nowhere near where it needs to be. It will take some time, but we are on the right track. We've changed the resource where we need to. We are recruiting where we need to. We will get it right.
Thank you for coming in. Thank you for coming in on that. Sorry.
Thank you so much. Thank you for everything you've been saying tonight. Obviously, I haven't been involved so much as the councillors at Deep Cut. One thing I would be interested to know is, do you have any working relationship with I can't even remember who it is now, the Frimley fuel allotments? When I was on the committee, it is a council, sort of an outside body, I was a member of the Frimley fuel allotments for several years. And during that time, I visited residents in Accent Housing at Deep Cut, Dettingen. I also visited, and that was for carpets, to get replacement carpets. We didn't, I think we had one occasion where somebody wanted something and we said, here's some money. And then they didn't, surprise, surprise, it didn't happen. So they had dealings direct with the carpet company and said, we're needing this Frimley fuel allotments, paid the carpet company. The carpet company went out to the property that belonged to Accent and put the carpeting in. There was also a property, I remember, up on the Old Dean, where Frimley fuel allotments paid for a cooker. There was someone at Frimley where they did a fridge or something. So this was all through Frimley fuel allotments, who were helping. I think at that time it was, I think the title was In Need and Distress. I don't know if they've altered the criteria, but it might be worth getting in touch with, because they did an awful lot of work with Accent, and it would, help you guys. I just don't know what your relationship with them is, or if you've had any dealings at all, but I'd just sort of tossing that idea across, see if it might be helpful.
I think it's a brilliant idea because, we had similar things when I worked in another housing organisation in Bedford, and now we've got Louise here, who will be working very closely with our residents. I'm sure Louise will be looking into that.
Yes, thank you. I'll have a look into that. Thank you.
And another Louise to Louise. I will make sure that you facilitated with the contact details to help you make contact with that.
David?
Yes, thank you. Actually, after all the ear bashing, a bit of applaudit. The roadshow, or whatever you wanted to call it, that pitched up in Watchetts on the 3rd of August, went really well, really popular. It's saved a few things coming across my email because it went direct to you guys. The police turned up, I was there, Borough and County Councillor, there was officers from this place, I think it was Green Space Enforcement. Are you going to do it again? Because it worked so well.
I would imagine we are. We've got a door knocking on Friday. I haven't got the addresses or anything. Do you know? Yeah, here. There you go.
Thanks. We are having a similar-esque event on Friday. It's real grassroots engagement, going around literally knocking on doors of as many people in the Surrey Heath area that we can target. We've got quite a big team, and we've got people from across the country who come down and support with that. And the aim of it really is predominantly to improve our customers' experience and to get to know our customers a bit better and find out what they want to see from us. Going forward, as I get more into the role, that sort of thing will fall under my remit, and I would absolutely love to do more community days and outreach days. I'm really keen myself to get around and meet the residents within this area, so we will be doing that again.
Yeah, if I may just come back very quickly, and I'm glad David put a positive in there as it happens, because you know, I think everyone here, I hope I speak for everybody here and say we want you to succeed with this. You know, some of our most vulnerable residents are looked after by you people, so we want you to do the best job possible. I understand fully, and I'm sure everyone else here does, that you know, recruitment and all these things, you know, skills deficits everywhere, it's a national problem. However, and this is one, I don't know whether this is for a recommendation, and I don't know if Louise might be able to help here. You know, we hear from at various executive meetings and so on that, you know, we have a mega shortage of affordable housing in the borough, we know that, and that there are talk about doing strategic partnerships with housing suppliers and all the rest of it so that we can build more. But I've got to say, as things stand right now, I would be very reluctant to do anything like that with Accent Peerless, which is a shame. What I'd like to understand, if I may, is this a problem with other, because we have other housing providers in the borough. Are they experiencing the same problems? And I think that I don't like to hear, I've always said before, I don't care what's going on in other boroughs. It's not our concern. I'm only interested in what's going on in this borough. But actually, I think it's relevant here because, you know, we do need to build more houses. We do need to have more partnerships with housing providers. But this particular problem has gone on for way too long. And I think, actually, I want to hear that it's a problem elsewhere as well, to be honest, because it might make me feel a little bit better. But we've got to solve this one way or another, and you keep coming back every month, and we don't seem to be getting anywhere. So, Louise.
Thank you, and thank you, Chair. With regard to other providers, we just haven't got the sort of size of provider in the area. So I don't think we hear the problems. One thing I do know, and with my other hat on from an HR perspective, is that there are real skill shortages in this area. I think we probably all do know that, and that is something that generally right across the board people are struggling with. I know that Jane Boytle is currently reaching out to other housing providers in the area. So if I get further information, I will obviously come back to you. We
I'd
are
like to hear
finding
that.
it more difficult to get hold of them, which I would say then from Accent and from a positive perspective, they engage with us and obviously make sure that they do come along and obviously give us the information up to date on a regular basis. But yeah, we are reaching out because it's something that the committee has asked for us to do, and that has proven a little difficult, but we are still working on it.
Yeah, thank you.
Yeah, just to add on from what Louisa said, I think it was about a year and a half ago, I think we asked to get other housing associations in, and Jane tried and tried and tried and tried, and essentially because their provision in Surrey Heath is so small, they don't have the level of staffing that Accent has dedicated for certain areas. So it's proving difficult. What I do want to say to Accent and to Ian Williams, while I gave you a bit of a hard time earlier on individual stuff, I would say more generally your communication has been a lot better. Just noting what Councillor Lewis said, that the photos from that and the impact that the drop-in event in Watches had was really well felt across the borough, and I think a lot of other areas want one themselves. So I do commend you on that. I think your much more general communications with the borough as residents has improved, and I do hope that in 3 months' time, when you come back, as you say, you're going to have a much better result. I accept there's other things, so my fingers are crossed that you do, because I remember last time when Julie Wittich was here, I said to her, what am I going to say to you in 6 months when there hasn't been an improvement? And I don't like bashing accent. I want accent to proceed, as Councillor Deep said, but I really do hope, and I hope that in the next 3 months that you are able to overcome those skill shortages, which I hope you are, that you're going to be in a much better position. But as I said, much better on the general communication, so thank you for that.
Any other questions? No. Okay. Edith, can I thank you on behalf of the committee for being here in person tonight, along with your team, and all the information and all the answers that you have been able to give. We meet again on Tuesday, the 29th of November, so we'd very much like to see you in person again. It is very important for us to have you here. Zoom's good, but to have you actually here, being able to see face to face, it does make a difference. So thank you very much, and thank you for coming, as I say, with your team to be here tonight with us. Thank you. Thank you very much, and thank you for all our guests tonight. It's been a very interesting evening, listening to all the good work that's going on across the borough. Thank you. Thank you. Yes. Yes. We're just going into some other committee work here, so do feel free to go if you wish. Thank you very much. Safe journey home. Thank you.
I'll make sure that's passed on.
Thank
Do you
you.
want me to say something? Okay, I'll make sure it's included and I'll include it.
Yes, thank you. Okay, work programme. So members, we'll now look at the committee work programme. I have to say that we did, in fact, invite Surrey Search and Rescue to this meeting as planned, but we didn't get a response from them. So they're obviously not here.
Maybe we can make you disappear now.
Which was a great shame. So we're now looking at the rest of the programme through to next year. So next meeting is the 29th of November. So we have Accent coming again. We've got the Surrey Heath Tree Wardens. Now, on our briefing, Morgan, myself and the officers have looked at the 29th of November to rejig it slightly. Since we last met, as we all know, things have changed with the everything that's going on in the country, with cost of living and everything else. And we just feel that perhaps it would be good to bring back Citizens Advice Bureau. They were here earlier, they always come every year. But to see what is happening by then, at the end of November, they will have a feel about what is happening in the community and how the workload's going. Josephine.
What about your sanctuary? Are they still, I'm sure Louise knows if they're still in existence. We have had them here, and I think we have helped them in the past. I just thought it might be, or perhaps is there something, I think domestic abuse has been quite high in the news, and I wondered if perhaps there's something on sort of in that
Well, we do
line
have,
we might
we do
add?
have other things people that we think would be good to come shortly, and perhaps November or the February one, which is the warm banks. The warm banks, this is where we'd be sharing buildings, so people can go to them. Do you have any update? Yeah, if Louise will update us on that.
So just coming back for Chair, just regarding the domestic abuse item, there's been some big changes in provision around domestic abuse. I think November might be a bit early, but if we are going to bring citizens' advice up to November, but perhaps we could then ask them to come along in February and give a presentation then, because yes, there has been a lot of change in legislation as well. So perhaps share with the committee what is going on with regards to domestic abuse, because as I say, it's very key. And then with regard to just following up with regard to the November meeting, it was very much about just with regard to the economic crisis and energy bills, etc., just trying to be timely with bringing in organisations which could give us up-to-date information. So we were talking about, as you say, Chair, Citizens Advice Bureau. We're also looking at food banks as well, to also come in and give us the latest position. So again, we can try and be as proactive as we possibly can. And just to share from the warm bank perspective, there's an item going to the executive, which is looking at updating a provision that we already have around our grant system, and whether we can then use that for, again, charities and external charities to apply for to help with providing a warm bank. And as you say, a warm bank is somewhere safe and warm that somebody can go and attend in the day, so that if they're going to turn their heating off or they're worried about their heating bills, they've got somewhere safe to actually go.
Marks and Spencers have a walk around there. Do that for a couple of hours. What about Street
absolutely.
Angels? We had those quite a while ago. I mean, there's something, and I'm sure a lot of people don't realise what they are. Sorry? Yes, I know. Well, they obviously couldn't with COVID. Yeah, because we had them a few years back, and it was really they were quite interesting. But I think that was, I think at that time, which I said was a while ago, you had to be a member of the church, otherwise you couldn't. And I think the last time I spoke about it, they said, no, you don't have to, because I think they were quite keen to get people along. But I'd never heard of it until it came to this committee. So I think it might be, for a future thing. Yes, yeah. And they said, and everything had to shut down. But I didn't realise that they always carried, a pair of flip-flops with them. That was sort of part of the rucksack that they had with them, flip-flops, because people go out and all the men in the high heel shoes, so things like that. And you sort of when you go somewhere, you feel hot, then you come out and I think they have a blanket flip-flops. I can't remember what the other, is it drink? Water, right. Lollipops, that's it, for the sugar, isn't it? Things like that. I think they do a brilliant job, and I think that would be something that, perhaps in the future that we could bring forward. Thank you. Have you? Oh, they wouldn't let me. Clearly, I'm a bad influence. Morgan.
Yeah, it's just...
Yeah, are you talking? Are you talking about the bag shop Waitrose? Yeah, they're emptying it more, I think. Yes, because... Yeah. Yes. And also, Waitrose at Bagshot have very kindly given the old Dean Food Bank £1,000 recently, which is very good, isn't it? Yeah, Paul?
just from a personal perspective, I think that it's right that we invite organisations at the front end, so from November and maybe the next committee, that are related in some way to the cost of living. That would help me as a ward member to understand what help is available, because I've got to say, from what I'm listening to in the news and everything else, and I hope it is being overinflated, but it's scary what we might have coming. And I think it's right that we prioritise our work programme around that, if that can be for November and perhaps the one after. And then after that, I'll be long gone. So. Oh yeah,
Sorry, David.
Thanks. Actually, this may happen further up the food chain than this, but if it's going to go downhill, is it worth having a different format meeting and have more sort of open discussion rather than group present, question, next group, so they can all interact and we can actually find solutions between the different groups and us?
A workshop.
Yeah, sort of thing, rather than have this more formalised.
Is we've already got some of them lined up, like the tree wardens. We've been trying to get onto this committee for ages now, and I don't think it's very good, or unless we move them on to February.
We could just move them around, Chair. Just then
Yeah.
we could facilitate them with a workshop style, if that's what you'd like
Yeah.
to try.
Yeah.
We can try and do that for
Yeah,
next time.
and move perhaps
Yeah,
the
we can
tree
still-
wardens on.
Yeah, we can bring them in, and then they'll be going into the spring, won't they, with regards to maybe. I know that Jane's still looking into that, but yeah, we could still do that.
Shall we go along that line
Yeah.
then?
Yeah.
And leave it to us and Jane and
Yeah.
Morgan and I,
Yeah.
that we'll prioritise these sorts of groups that you're talking about. So, yeah. We will look at this sort of thing, to bring these groups in and maybe move some of the others to February. If that's an agreement.
Before, so that these are priority questions or something. I mean, I'm sure every presenter who comes here knows their stuff, but it's just so we can get through some things, because members are very passionate about what they want to put forward. But if we can say, these are the questions.
Yeah.
This is what we really want to know. It's great to hear about everything else, but these are the key points that we want to know about.
Important at that time.
Yeah. Yeah. So it's that way people can get their points across.
Yeah, Louise is going to come back.
So just taking those points all on board. So with regard to November's meeting, what we will look to do is set up and bring in groups around the cost of living crisis, but actually change the style of how we actually do that meeting. And we'll talk with the chair and vice chair, and then come back to the committee with regard to then questions that you would like to understand and know, so that again they can come pre-prepared with that information. Is that sort of summing up what you would like to see at the next committee? Yeah. Okay.
Bring Beeson back.
Yeah.
I mean,
Okay.
sort of people can bring back as Beeson itself.
Yeah. Absolutely.
Oh, sorry.
That's it. Oh, there's.
It's not necessarily a work committee, but it's more of a point for Louise. I'm just wondering, because obviously November we're potentially going to be in the midst of. I'm just wondering, can we just potentially prioritise in terms of council communications in like the next couple of weeks, identifying these are the food banks that we have. It's more of a kind of an office operational task to do rather than a committee thing. But as Louise is here, I thought I'll just raise it.
Chair, just to come back, yes, absolutely, we can confirm. I know that social media, we are making sure that we're promoting the Household Support Fund, and that's continuing. But I take the point you make about widening that out and making sure that's all available. So, yeah.
It is Louise's last meeting with us, so I'd like to thank you, Louise, for all your help and everything you've done for this committee. It's been a joy having you on board. we wish you well at Wokingham, a new challenge, and we shall miss you. We shall miss you. Thank you very much, Louise.
Thank you very much, Chair, and I know that, so thank you very much. But I will make sure the work that we've just talked about is completed and is passed on. So, okay.